Hi, I'm Dr. Sanjay Chabra, Director of Rheumatology at the Texas Arthritis Center in El Paso, Texas, and you're watching Clinical Conversations with SAPHNELO. SAPHNELO is indicated for the treatment of adult patients with moderate to severe systemic lupus erythematosus, or SLE, who are receiving standard therapy. The efficacy of SAPHNELO has not been evaluated in patients with severe active lupus nephritis or severe active central nervous system lupus. Use is not recommended in these situations. Please view the complete video for important safety information and see full prescribing information, including patient information, at SAPHNELOPI.com. SLE is a very complex and heterogeneous disease, and as rheumatologists, we have the understanding that the disease course is dictated by how the first 5 years are managed. I can only imagine how many patients with uncontrolled disease activity may benefit from starting on a biologic earlier in their treatment course to help them reduce SLE disease activity and potentially address the development of organ damage caused by the disease over time. This brings us to my patient JK, a real person living with moderate to severe SLE. JK is in her early 50s and works as a school teacher. When she came to my practice almost a decade ago, she presented with fatigue, dyspnea, photosensitivity, and arthralgia of the wrist and elbows. She also presented with a skin rash and comorbidities like antiphospholipid antibody syndrome and hypertension. Notably, she had a significantly elevated ANA titer, yet tested negative for dsDNA, which are highly specific for SLE. So in line with my approach, I started her on standard SLE therapies. As time went by, we realized that the hydroxychloroquine and steroids weren't helping a whole lot. She was still having symptoms, so we added DMARDs to her treatment plan. Her joint pain improved to some extent, but not significantly, and the fatigue was still there. She just wasn't getting to where we would have liked her to be, especially while being on a steroid dose of 10 milligrams a day. In the past, we may have been more complacent, tolerating a certain level of steroids as long as the patient remains stable. But I think those days have passed, since evidence has shown us that even a low dose of steroids can lead to cumulative toxicity in the long term. However, every time I tried to bring her dose down, even from 10 milligrams to 9 milligrams, she would have to go back because of the worsening arthritis. And then later, we found out she was starting to develop anemia as well. I said, at this point, you're still serologically positive and clinically active. You're continuing to have the same symptoms, and now we're also dealing with anemia. We're ticking off too many disease activity scores here. So I decided we should discuss adding a biologic to our treatment plan. I chose SAPHNELO because our main goal was to reduce disease activity, and I wanted to address her steroid dose. With SAPHNELO being added, I thought we had a good chance at that. I based that on the safety and efficacy data and also with my experience with other patients. Around the third infusion, I remember her asking, is it a placebo effect? We looked at the labs and some of her markers did start to improve. And shortly after that, we were able to reduce her DMARD and completely taper her off of the steroid. For a gal who had been on 10 milligrams of steroids for over 2 years, that was a pretty big change. Now she's on her lower dose DMARD in addition to treatment with SAPHNELO. Today, her labs show normal complement levels, resolved anemia, and fewer signs of inflammation. She is doing well and still tolerating SAPHNELO and continues to be tapered off of steroids and hasn't had any recent flares. JK is one of those people who is really committed to her job. She takes a lot of pride in being an educator and doesn't want to call out sick, so she's been very pleased that she can come in the morning to get her infusion that we administer over a 30-minute period, and then tolerate it well enough to go to work afterwards. As a doctor, it's liberating in the sense that this is now a person who has disease control. JK can certainly call us at any time if there's a flare, but we're stretching out the visits now. The visits are better because we're able to see what she is doing rather than what she is not doing. It's very satisfying to have an option that reduces her disease activity, reduces her steroid use, reduces the flares, and allows her to focus on things she loves. Please continue watching as I read through the important safety information. Important safety information. Contraindication. SAPHNELO is contraindicated in patients with a known history of anaphylaxis. Warnings and precautions. Serious infections. Serious and sometimes fatal infections have occurred in patients receiving immunosuppressive agents, including SAPHNELO. SAPHNELO increases the risk of respiratory infections and herpes zoster. Use caution in patients with severe or chronic infections. Avoid initiating treatment during an active infection and consider interrupting therapy in patients who develop a new infection during treatment. Hypersensitivity reaction including anaphylaxis. Serious hypersensitivity reactions including anaphylaxis have been reported following SAPHNELO administration. Events of angioedema have also been reported. Other hypersensitivity reactions and infusion-related reactions have occurred following administration of SAPHNELO. SAPHNELO should be administered by healthcare providers prepared to manage hypersensitivity reactions, including anaphylaxis and infusion-related reactions, if they occur. Immediately interrupt administration and initiate appropriate therapy if a serious infusion-related or hypersensitivity reaction such as anaphylaxis occurs. Malignancy. There is an increased risk of malignancies with the use of immunosuppressants. The impact of SAPHNELO on the potential development of malignancies is not known. Immunization. Avoid the use of live or live-attenuated vaccines in patients treated with SAPHNELO. Use with biologic therapies. SAPHNELO is not recommended for use in combination with other biologic therapies, including B-cell targeted therapies. Adverse reactions. The most common adverse reaction, incidence greater than or equal to 5%, are nasopharyngitis, upper respiratory tract infections, bronchitis, infusion-related reactions, herpes zoster, and cough. In controlled clinical trials, the incidence of infusion-related reactions was 9.4% in patients while on treatment with SAPHNELO and 7.1% in patients on placebo. Infusion-related reactions were mild to moderate in intensity. The most common symptoms were headache, nausea, vomiting, fatigue, and dizziness. Use in specific populations. Pregnancy. A pregnancy exposure registry monitors pregnancy outcomes in women exposed to SAPHNELO during pregnancy. For more information about the registry or to report a pregnancy while on SAPHNELO, contact AstraZeneca at 1-877-693-9268. There are insufficient data on the use of SAPHNELO in pregnant women to establish whether there is a drug-associated risk for major birth defects or miscarriage. Advise female patients to inform their healthcare provider if they intend to become pregnant during therapy, suspect they are pregnant, or become pregnant while receiving SAPHNELO. Lactation. No data are available regarding the presence of SAPHNELO in human milk, the effects on the breastfed child, or the effects on milk production. Pediatric use. The safety and efficacy of SAPHNELO in pediatric patients less than 18 years of age has not been established. Please see full prescribing information, including patient information, at www.saphnelopi.com. Thank you for watching Clinical Conversations with SAPHNELO. Visit SAPHNELOHCP.com to learn more and consider SAPHNELO when treating your adult patients with moderate to severe SLE who are receiving standard therapy.